When we think about hip pain, we often just chalk it up to getting older, right? A frustrating annoyance we just have to live with. But what if I told you that ache that wakes you up at night could actually be a warning sign for something much more serious? Let's talk about the hidden link between that pain and a major health risk you might not even be thinking about.
Does this sound familiar to you? You're finally comfortable, you're just about to drift off to sleep, and bam! A sharp, deep ache in your hip jolts you awake. So you shift, you turn, you try to find a new position, but it feels like the pain just follows you around. It's a total thief in the night.
Well, if you're nodding along right now, listen, you are so far from alone. Millions of people are dealing with this exact thing night after night, and it's so much more than just a little annoyance, isn't it? It robs you of your rest, and then you're left feeling exhausted and just cranky the next day.
Okay, so what is actually going on in there? Why does it hurt so much? Well, for a lot of people, the main culprit is a condition you've probably heard of, hip osteoarthritis. Let's really dig into what that means for your body.
Think about it like this. The cartilage in your hip joint. It's kind of like the cushiony sole in your favorite pair of walking shoes. It's there to absorb shock. Well, osteoarthritis is what happens when that cushioning, after years and years of use, just starts to wear thin. It loses its bounce, its ability to protect the joint.
And this image really paints a picture, doesn't it? On the left, you see that healthy, smooth white cartilage. It lets the joint glide around effortlessly, no problem. But then, look at the right. In an arthritic joint, that protective layer is all frayed and worn down. In some spots, it's gone completely. And that's when you get that awful bone rubbing on bone situation, which is what causes all that grinding, that stiffness, and that deep, relentless pain.
So that bone-on-bone friction, it shows up in some really specific ways. Does any of this ring a bell? The pain isn't just in your hip, but it travels to your groin or down your thigh. Or what about that classic morning stiffness that makes just getting out of bed feel like a huge chore? Maybe you even get a weird locking or catching feeling in the joint. If you're recognizing these symptoms, you're seeing the whole picture. But here is where the story takes a really critical turn, and this is so important. This isn't just about managing pain anymore. That constant sleep-robbing ache actually sets off a dangerous chain reaction, leading to a risk that is much more immediate and, frankly, much scarier.
Get ready for this number, 36 million. The CDC tells us that's how many falls are reported among older adults right here in the US every single year. It's a massive, staggering number, and your hip pain is directly connected to that risk.
You can see the domino effect so clearly right here. It all starts with that chronic pain in your hip. That pain messes up your sleep. You're not getting good restorative rest. So then what happens? You're exhausted and drowsy during the day. And when you're tired and groggy, your balance is off, your reactions are slower, and your risk of a really serious fall just skyrockets. See how one thing leads directly to the next?
Okay, but here's the good news, and it's really good news. This is not some foregone conclusion. You can absolutely break that chain. So let's shift gears and talk about an action plan. Let's get into how you can manage the pain and seriously cut down your risk of falling. Your doctor has a whole toolbox of things that can help. It often starts with lifestyle changes, gentle exercise, physical therapy to strengthen the muscles around the joint. From there, you might talk about things like anti-inflammatory meds, or maybe injections to calm things down. And look, for severe cases, hip replacement surgery is an incredibly common and effective solution that literally changes lives.
And hey, while we're talking about medications, this is a really critical point. Some drugs, even ones you can buy over the counter, can have side effects like dizziness or drowsiness, which, guess what, can increase your risk of falling. This is why it is so important to go over every single thing you're taking with your doctor or pharmacist. You got to make sure your treatment isn't accidentally making the problem worse.
And here's something you can do to take control starting today. Make your home safer. We're talking about simple changes that make a world of difference. Get rid of those little throw rugs that can trip you up. Put some grab bars in the bathroom. Make sure your hallways and stairways are really well lit. These are small, easy things that can give you such incredible peace of mind.
All right, so we've unpacked the problem, we stared the risks right in the face, and we've laid out some real solutions. Now, it really all boils down to one simple thing. What's your next step?
Please, I'm serious about this. Don't just accept this pain as your new normal. The most powerful tool you have is your own voice. Just having an open, honest talk with your doctor about the pain, about your sleep, about what you're worried about, That is the absolute key to getting a proper diagnosis and a plan that's right for you.
Look, it's easy to feel a little overwhelmed by all of this. I get it. But just remember this. The journey to sleeping better and feeling safer begins with just one single step. The most important step isn't some giant leap. It's just the next one you decide to take.
So I'll leave you with this question. What's it going to be? Will it be making that call to your doctor's office? Maybe just clearing some of that clutter out of the hallway tonight. We've turned a bunch of information into some real understanding. Now it's your turn to turn that understanding into action. What will your first step be?